Assalamualaikum warahmatullahi wabarakatuh. Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillahi wa ba'd. Welcome to all the viewers from wherever you are all over the world. So today we have Dr. Khalid El Kashlan as one of our guests. And obviously we have our brother Muhammad Thompson here. He's always with us, alhamdulillah. And as most of you know, the 27th of September to the 1st of October, no, sorry, the 3rd of October is the Mental Health Awareness Week in New Zealand. So I thought it would be good for us to start this discussion and about the mental health awareness by having Dr. Khalid, who is currently working at Tiaho Mai unit. Did I say that correctly, Khalid? Tiaho
Yeah,
Mai
yeah.
unit at Middlemore Hospital. And we'll have a discussion in general about mental health and what to look for and what are the signs for. And inshallah, throughout the week, we'll be discussing a few more topics around mental health from the Islamic perspective. And maybe, inshallah, we'll try to get a psychologist to have a discussion about what is actually CBT and more of that, inshallah. So first and foremost, before we start, inshallah, if you are in New Zealand, if you need any sort of help, the first number that you can call, the first person that you can go to is your doctor, is your GP. And the number that you can call if you need help is the 1737. Uh, whatever background you are, Muslims or any other faith, you can call these numbers and you can, inshallah, find someone who can actually uh, understand you from your background, from your perspective. My understanding, and there are also Muslims, psychologists who are working on the line as well. So this is a good number to remember. And if you need some sort of an advice, if you're worried about someone, obviously you can ring this number and get the help. So that's how we start, inshallah. So, Brother Khalid, I'll just get you to introduce a little bit about yourself, and then we can have a discussion, inshallah. We can start our discussion for today's, inshallah.
Well, thank you, Firdaus. I appreciate you trusting me, and I hope I do not let you down. So my name is Khalid El Kashlan. I'm originally from Egypt, and I've been in New Zealand over 20 years. I'm what's called a medical officer professionally, which means I'm generally registered with the medical council, but I've got enough experience in a particular field that is actually recognized by the field that I work in. So I can't call myself a psychiatrist, but could have been working in the field for almost 20 years now. And yeah, that's about it professionally. Nothing particularly interesting. I've been working in both outpatient and inpatient settings. Most recently, I'm working in the ward in an inpatient setting. So you get to see the severe end of the spectrum of mental illnesses.
That's right. If I remember correctly, Khalid, I was a medical student and you were working in geriatric mental health in Porirua, in Kenepuru Hospital, if I remember that
Yes.
correctly. Yes.
Yeah. Mhm.
So you work in many different fields now. I think Tiaho Mai unit is a acute mental health unit where um, I believe people with schizophrenia and all other illnesses that need to be stabilized. This is where they go to. Am I correct?
Yes, I mean, generally speaking, and again, everything I say is kind of my own perspective. I'm not representing anyone. But generally speaking, what I understand in New Zealand now is the inpatient units are mostly for situations when there is risk. So, in a sense, if there is an active risk to oneself or others, or risk because of inability to care for oneself, that's when a person is admitted to the inpatient unit. Apart from that, no matter how severe an illness is, the focus is to try and treat the person in a community setting. So in the inpatient unit, you can have many different diagnoses, but the main thing to keep in mind is that the risk is probably too high to be contained in the community.
Right. So, so Khalid, so we had a discussion about this before with regards to mental health in general. Obviously, there are many terms out there. You know, bipolar, schizophrenia. People might heard that. OCD, depression, anxiety. But the most common one that people suffer from are anxiety and depression. And I think one of the statistics that I've read recently talks about 1 out of 4 people in New Zealand suffers from anxiety. Eh, So sort of almost everyone suffer anxiety at some point in their lifetime. And the thing is, Khalid, one of the thing is, when you suffer from anxiety, when we suffer from anxiety or depression, sometimes the symptoms that we have, we may think of something else, the lack of sleep, nervous, excessive worrying, and all these are all the signs, and the signs are quite broad. Am I right on that?
Absolutely.
So, and I think one of the things that I think we ought to mention now is with this COVID-19 and with the lockdown that we go through in New Zealand or any parts of the world, with the lockdown, you are, you cut off that family support or the extended family support and the interaction as a human being from one person to another person, and that can actually make you more anxious as well. And on top of that, when you read the news, the more you read about the news, sometimes the more scary it becomes, and you become quite fearful of COVID-19. Obviously, we're not downplaying COVID-19 or anything like that, but what we're saying is, the effect of constantly reading about COVID-19, constantly reading about the scares and the media and all that, that can actually affect your well-being as well. Um,
Yeah.
yeah, go on.
Oh, no, I agree entirely. And what I've seen is that with the lockdowns and COVID-19, there have been different reasons for different people to be either depressed or anxious. I mean, some people are concerned about the virus itself and getting the illness and how that would affect them and affect their loved ones. Other people, it's the change of their routine that they find most distressing and anxiety provoking, particularly if people had a particular setting of what to do every day and who to see and different activities planned out throughout the day. And all of this is stopped because of the lockdown. So that causes a lot of angst. And then you get others who, like you mentioned, is purely about the social interaction. They're not so worried about the COVID itself or the infections. They're not worried about their livelihood. I mean, they go to work, but it's missing out on being with their friends and being with their family members. So again, even though it's all anxiety, and on the one hand, the main trigger is the same, which is the lockdown, the COVID-19, people's reactions to it and the reasons they've reacted to it is quite different. Some people really haven't been affected that much, in a sense, particularly those who are essential workers and go to work, they feel that everything's the same. And particularly in Auckland, it's wonderful because the roads are free. But apart from that, it's quite different how different people experience it.
Mhm. Yeah, I just wanted to share one thing. So, anyone who's watching is today, there are a few apps and there are a few programs available out there, and one of the common one is the Mentimia with John Kerwin. Most have heard of John Kerwin. So, this is one of the slideshow that they put out about 12 ways to mental well-being in the age of coronavirus, and I think some of these points here you can actually relate that Islamically as well. However, we'll just talk about these points in general, and Khalid, maybe you can explain, and Mama Thompson, if you have any question on this. I mean, one of the things that I found, being a GP as well, is when my patient came to me and then they say, "Look, I'm anxious or I'm nervous." Being anxious is normal. You can't run from being anxious. You have to be anxious somehow, and we all will go through that at some point in our life. I remember when you're at the university and you're studying, your exams coming up, you become anxious, and that's normal. But when it's become abnormal, when it's overrule your thoughts, and then it's constantly there again and again and again and again and again, and you are not able to do things. So one of the things that on the slide here talks about how focus on things that you can actually control. The truth is, none of us can control about what happened, the decision on lockdown, or whether the virus going to mutate or not mutate or whatever. So we can only control what we can control. So we do what we can do, and knowing that that's all that we can do, and that's most important. And the next one is be in the now, as in you think of the present. Don't think so much of the things in the future, because that's when you start getting a bit worried. Because sometimes we don't feel like there's no end to this coronavirus. Take breaks, and which is important. Although if you are in lockdown like us in Auckland, you've been taking some of us took break for about 6 weeks now, and it might be too much of a break. And go easy on yourself. I think that's straightforward. Have things to look forward to, and I think this is something for us as a Muslim. We always look not just the what happened now. We look at the end of it. How our life and our life, not just this life and after this life. But inshallah, we'll discuss a bit more about it. Acknowledge your feelings. Look after your body, which is Brother Muhammad Thompson is pretty good at this. Don't eat too much. He's fasting quite a bit, and he's exercise. He walks every day, and stay connected as much as you can, and then take time out from the news, because sometimes the news, it just constantly the way how they report, look, if we do this much people will die. Do we do that? That's much people will die. If we don't do this, and then you start freak out when you think about this. And then again, to have a routine that you do, and obviously have a bit of relax and laid back, and take some jokes, and a bit of comedy will be good for you as well. Alhamdulillah. Khalid, would you like to explain a little bit more about the slides, or from your perspective?
Well, yes, I mean, essentially what you said, Firdaus. I mean, in psychiatry, things are very general and very vague compared to other areas in medicine where it's a lot more defined and things are clearer. So with mental illnesses, some illnesses are clearly illnesses, like in psychosis, where you hear things that do not exist, or you've got delusions, or feel things that are not there. That's clearly an abnormality. But then in many other aspects, such as with feelings, whether you're overly happy, or whether you're depressed, or whether you're anxious, all of these are within themselves normal feelings and normal experiences. We all have good days and bad days. We all have days when we feel more chirpy and everything seems quite hopeful, while other days where one feels gloomy and everything seems quite pessimistic. And all that is normal. The same thing with anxiety. I think it would be great if we didn't get anxious, but we do. It's part of life. And in psychiatry, the way many diagnoses have been made is dependent on how whatever symptom it is affects the functioning. And that seems to be the bottom line in saying whether or not a person has a mental illness. And unfortunately, because of popular culture, people seem to think that they have to be in a wonderful, happy state all the time. So every time people feel a little under the weather, feel a little bit anxious, depressed, unhappy because of issues around work or in their social life or marital life, then they automatically want to go to their GP and ask for antidepressants. Whereas the reality is a lot of these experiences, as unpleasant as they are actually part of normal life. Once it starts affecting the person's functioning, then it becomes a diagnosable psychiatric condition. And that's what we see with kind of mainly anxiety and depression. It's an exaggeration of normal. And like I said earlier, different people became anxious regarding coronavirus for different reasons. So with anxiety, in my view, psychotherapy is the best treatment, far more efficient in my view than medications. And in this case, it's best to be targeted. So, okay, this person is suffering from anxiety because of the situation we're in, because of COVID-19 and the lockdowns and the country's borders being closed and all of that. But what aspect of this is provoking the anxiety? And that's what needs to be addressed. So in many cases, like some people I know, so when I talk about the pandemic and, oh, look how terrible it is, when you compare it to pandemics over history, this is nothing. What we're going through now. When you read historically about the plagues people were affected by, things like the Black Death in Europe, even the Spanish flu in the early 20th century, this is really very mild compared to what people have been through in the past. Again, like I said, not minimizing it, but at the same time not catastrophizing that this is somehow an apocalypse or it's the end of the world. It's a relatively mild situation compared to the past. If a person is concerned about their lifestyle, well, many times we've had to adapt to different situations. I mean, like Brother Muhammad said, we're all immigrants to New Zealand. And having to come to a new country and leave the country that you were born in and raised in, or leaving the people that you have grown up around, that in itself is very anxiety provoking. And it needs a lot of adjustment to come to terms with where you are and to start a new life. So having to adjust to lockdowns, about having to wear masks, social distancing, all these things, in comparison, again, they're relatively minor. So it's putting things in perspective. It is an inconvenience, and I normally wear glasses. I'm not wearing them because I'm short-sighted. Um, but with wearing masks and glasses, it's a headache because they're always fogged up.
Yes, yeah.
and
No, we can share that experience. Yeah.
yeah, but then okay, it's something we need to do. So I just got to live with it. So ultimately, it's each person and their experience and how best to focus on the issues that trouble them.
Mm, mm, mm. So, that's what about are you able to a little bit explain about depression in general? And because you're able to explain to us about the more serious one and the more common one, which I normally see in general practice. Just a little bit about depression, Khalid. What are the symptoms that you look for? I mean, we talk about anxiety because that's what mostly what COVID-19 does, give you an anxious, but no, it make you anxious. But depression is just another thing as well that can come after that. Because when you're excessively anxious, when you think that the world is doom and gloom, and your mood start to goes down and down and down, and you don't feel like doing anything, you don't feel like going out, you don't feel like being do anything. You just feel like you just want to sleep and sleep in bed and sleep and not getting up. So just a little bit more about depression, if you can, Khalid.
Again, similar to anxiety, there is an element of normality in it, and most of us have periods when we do feel a bit down, when things come on top of us and don't feel like doing the things we normally would like to do. But again, it's the functionality and the range. So at face value, everybody knows, like, when you're depressed, you feel your mood is low. Some people don't actually recognize that as such, because some people, when they're depressed, they actually just become more irritable. They're very difficult to deal with. And every time you come close to them or say anything, it's never the right thing. So some people do feel low, others it's more irritable. And usually these people, it's those close to them who notice it more than they do. In addition to some things, I mean, a major one is one you mentioned, is this what's called in psychiatry anhedonia. They always like these weird Latin-based terms or Greek-based terms, but basically it's a loss of pleasure. So nothing that you do would bring you pleasure. Things that, even regardless of how wonderful or how basic it is, but things that you would normally get pleasure from, like eating a meal, watching a favorite TV program, going out for a walk, people just cannot enjoy anything. In addition to physical symptoms, just like feeling tired, feeling that you just can't get out of bed, loss of appetite, uh, these kind of things, and it varies. So, in the Middle East, in particular, when people, whether men or women, get depressed, the focus is on these physical symptoms, and they do not acknowledge any mental illness. But no, something's physically wrong with me. Why do I don't have this energy? They go to different doctors, do different tests, all kinds of things, and everything comes back fine. The scans are fine, the blood tests are fine. Um, but they don't really focus that it's actually depression, that it's low mood, or that it's social issues that are causing me to feel the way that I feel. And I think in Western countries, it's going the other way around, where any minor thing, then the person's so focused on, I need a tablet, I need a pill, I need something to fix me. And you'd have to go through, well, I do acknowledge that you're feeling miserable, and I do acknowledge that what you're going through is unpleasant, but it's normal. Once it starts affecting the functioning at any level, whether it's going to work or doing your daily activities or caring for your family or caring for yourself, then it becomes a diagnosed entity. And that's when you start looking at, okay, what can we do to treat this condition? One of the most frustrating things about treating with medications is time. And I keep saying to many patients, antidepressants do not give you a high. They just make you less depressed and hopefully feeling normal. The problem there is that it takes about 4 to 6 weeks for them to work.
Yep.
So it's really annoying to take tablets on a daily basis and not seeing any effect until a month down the track. So that's one of the things you need to persevere with when it comes to tablets. Psychotherapy seems to have a more immediate effect. So the person is able to come to terms with, if you click with your therapist, because that's another thing that I emphasize, there are all types of therapies, but most of them are, the bottom line is, it's therapist dependent. So if you happen to find a therapist you just do not click with, where there's kind of lots of personality differences, it would probably not work. So if you find a therapist you click with and you're able to process what you're going through, process the different issues, then that tends to yield a much quicker effect than tablets. Long term, it depends on a person's outlook on life and how they view things, which is the part where religion, not just for Muslims, but religion in general, acts as a protective factor. And so that's kind of my spiel, if you like, about depression.
Now, you mentioned one word there, psychotherapy. What do you mean by that, Khalid? Because in general practice, we have now, as you know, in every almost in every GP practice now we have what we call wellness advisor, and then we have counselings, and then we have psychologists that do CBT and DBT. So when you say psychotherapy, what do you mean by that, Khalid? Because some of us might think of psychotherapy, these pictures of you sleeping in the sofa, with your head down, and someone listening to you with a pen and paper. So what do you mean by psychotherapy?
Yeah, well, you're absolutely right. It's a very broad and general term, and many people do it, and it can range from someone who's had a course of a few weeks to someone with a PhD, and they're all specialists within the field, and they all do different kinds of counseling and psychotherapy. There are many, and psychologists talk about this far better, but there are many well-defined psychotherapy models, like I said, cognitive behavioral therapy, dialectical behavioral therapy, supportive therapy, acceptor therapy. So they're very clear, kind of well-defined modalities. And then there's kind of general counseling where we're essentially having like a wise person to sound ideas off, and someone to help you process what you're going through. This image, like you described, of lying down on the couch and talking about life while someone sat behind you writing it down. That's usually kind of psychodynamic psychotherapy, which takes years, and when it was done in the past with Freud and the likes, it was mostly done with upper class ladies who had a lot of money to spend on this, because really, I mean, who can afford this nowadays? and not just money wise, but basically to put your life on hold while you're going through therapy. Anyway, so that's not done that often. It probably is done somewhere, but probably not done that often. And unfortunately, the mental health services don't actually provide counseling unless it's for like really severe cases. Otherwise, I think, and you know this more than me, Firdaus, it falls down to the GP practices. And I think what I'm told is by our social workers is that there are 6 sessions that can be funded through the GP practice and can be extended depending on the need.
Yes.
Um, and that's where, from the different patients and friends who I've talked to, the experience has varied, and the main variation has been dependent on the person, really. If
Yes.
if this it's a good fit between the counselor and the patient, it works really well. If it isn't, it doesn't work that great. And I have to emphasize that it's not your fault, it's not their fault, it's not the therapy's fault. It's just didn't work out.
Right.
And I would always encourage people to try again and persevere.
Yes. Now that's a very good point, Khalid, and it's actually you mentioned that this is what I said before at the start. The first port of call, if you wanted help, is to actually to go to your GP, and your GP now you have what we call wellness advisor. You can go and get have a bit of chat with the wellness advisor. They are well trained for that, and majority of them are actually from a either from a nursing background in the mental health or a psychologist or something along that line. So they're mostly they're well trained and they have their own set of standard that they do. And then if things are not, then you need if you need something a bit further, they can send you to a CBT, which what you mentioned before the counseling. It can go up to 6 sessions. One other thing though, Khalid, that I remind that I tell some of my patients are you can also actually reach out to your employer now. There are many employer who actually do a I think like race, I think the mental health, where you can actually go through your employer and get a counseling through your employer, which is funded by your employer. So that's something, I know one organization called Race, but I'm not sure if there are many. I think there are many out there, but I think the biggest one I knew was Race. So some of the big companies, they employ them, and then you can go through them and get a counseling through them. In additional, if it's sometimes it's easier to do that, and then you can also go through your GP as well. And I like what you mentioned about the tablet, Khalid. I mean, as a GP now, we don't just, I think probably before it's quite easy. If you're feeling a bit down, just take some citalopram or escitalopram or something like that, and then you go away. But I think now we acknowledge that there are a bit more to it than just tablets. And one other thing that I um, is I think in New Zealand we're quite common is to use that the model of Tifari Tapafa, which is basically the four pillars. And I'll just share this in our program today. So this is actually developed by Sir Mason Drury, which is a New Zealand psychiatrist. Is that correct? Mason Drury, I think that's his name.
Yeah, yeah,
Um, yeah. So he talks about there are four pillars, the spiritual, and there is the mental and emotional, there is a family and social, and the physical, which is, you know, and then this is what we're being trained as a doctors now. I remember go through this at Otago University, and then we were told, this is how the concept, the holistic concept of treating someone. So someone who have diabetes, they may not wanting to take the medications because they have other issues that they're thinking about. They might have some family issues. They might have uh, um, family issues or their spiritual issues, and therefore acknowledging that will help them to actually get better their physical health. So this I like the model. I think this is actually applicable to us, and I think for us a Muslim, we can, that spiritual part, which is actually important. Although I might like to, I might adjust it as a bit different, but I think in general this is actually a good concept that I use daily, day to day as a GP and dealing with someone with mental illness or mental health, any mental health issues. So, Khalid, let's just talk about a little bit about medication because there is a question there that talks about that asks about whether in the Muslim community there is a reluctance to accept help for mental illness or mental health. Just before we go into that discussion, um, with regards to medications, right? A lot of my patients think, when you mentioned that before, people thinking if you start a medication, you're gonna be like smiling the next day and happy and jumping, and which is not true. Like you said, the medication takes a bit of time to get better. And again, as a GP nowadays, we don't try to prescribe the medication. That will be the second, third lines. We try to have a chat first. That's why we try to go to the wellness advisor. They have a bit of chat, a bit of a discussion about, share their what their concerns are, what they're anxious about, and, and after 2 or 3 sessions they come and see a GP or a mental or the wellness advisor. Then maybe we consider the medication if we need to. So the medication is more of the not last step, but will be the next step after we try a few other things. which is unfortunate. You mentioned before, like, I wish everybody can go through a counseling, but there are many reasons why that doesn't happen though. Funding is an issue. Number two, most of us have their own jobs, they're busy, and taking some time off to go to a counseling, it's not feasible. And that could be because the work did not recognize or did not understand the mental health side of things. So, let's just talk about the medication, Khalid. Like, what are the, obviously you tend to see more at the extreme end. This is where you work at, in the unit, the acute mental health.
Mhm.
Obviously, the medication will be needed on those areas mostly. But, just a little bit about the medication, Khalid. Like, when the doctor decided to start a medication, normally they have a reason for that, and it can take a bit of time. Um, but what does, how do I say it? In New Zealand, how do you see it? How do I kind of lost train of thought there. With regards to the medication, yes, it's something that is one of the tools that we use to help us. But like you said before, the psychotherapy is the first line. Um, but when the doctor started you on the medication because they think that might be more beneficial for you to be on medication, it can take a bit of time. And a lot of people worry about the side effects. What are your thoughts, or what are your because you use a lot more medication than I do. If you can just explain a bit more about the medication use and that.
Mhm. Well, again, in my view, the use of medications depends on the patient's presentation. So, and also trying to understand why the person is presenting the way that they're presenting. So, with depression, I mean, with all of mental illnesses, the reasons are usually multifactorial. So there's a lot of environmental issues, and by environmental, that also includes alcohol and drug use, and genetic issues, which is our predisposition. And in mental health in psychiatry, it's very complicated. So there's no like one particular gene that causes this particular illness, and so this is how it's transmitted. It's all multifactorial, and it's the how much of that is involved in the presentation. So in a sense, on one end of the spectrum, you can have someone where there's certainly a lot of goings on in their life to make them or anyone depressed. And that's kind of understandable. So there's a lot of environmental factors there. At the other side of the spectrum, you can have someone who's got a wonderful life, but they're so predisposed to getting depressed that they actually are depressed. They've
Mm,
got all the symptoms of depression. They're miserable. They can't enjoy anything. They recognize that there's nothing to be depressed about in their lives. Some of them would actually feel guilty for feeling depressed because, well, everything's going well. Why do I feel the way that I do? But that's their genetic predisposition. And that's where medications help the most because there's actually very little to work on psychotherapy wise. They just feel really miserable. And for most of us, for most people suffering from depression, they would sit somewhere along this continuum. So there would be some predisposition, some genetic factors, but also environmental factors. And depending on how much the environmental factors are versus the genetic predisposition, that's when you start considering psychotherapy versus medications. So that's one thing. The second thing is actually how it's affecting the person. So if the person is unable to go to work, is unable to care for themselves or their loved ones, then you'd have to intervene a lot more aggressively. And when it gets close to almost life-saving measures, then that's when you consider electroconvulsive therapy, ECT, which is really very effective and in my view has limited side effects and it's a lot quicker. You see the effect after 2 or 3 treatments.
mm,
And so I wish I could give you a clear-cut answer that kind of one
mm,
size fits all, but there really isn't. You have to look at each individual case. But in general, that's how I think it should be considered. The first thing is functionality. If the person is feeling low, but they're able to function, then there is opportunity to start exploring different psychotherapies, lifestyle changes, maybe even using medications and saying, well, there will be no harm in it, kind of thing. If it's severer than that, then it's worthwhile actually being more aggressive with medications and looking at which combinations would be helpful. Beyond that, you have to look at inpatient treatment and whether it's augmenting the medications or using ECT.
Right. The one of the common thing that the patient will ask me is, if I start you on the medication, will I get addicted to it? From my experience, it's no such thing, because there's so many patients that who started on it and they stop on it when they get better, and then they never need to go back on it again. But I think mostly what people misunderstood is, normally when you need the medication, you need the medication. You know what I mean. I think that's what you mentioned before about the genetics, about the issues, and what because they're more predisposed to having a depression or anxiety. So maybe that's why they need the medications. What's your thought on that?
Yeah, well, I mean, with the antidepressants, you don't get addicted, but there
Mm,
is unfortunately what's called the discontinuation syndrome, which is that if you stop the medication suddenly, you can get a rebound of the symptoms.
yeah.
So that's why, particularly if you've been on them long term, then you need to wean yourself off them slowly. But it's not addiction. It's not like you don't get cravings for the
Yes.
antidepressants. You don't get the severe physical effects of withdrawals. There's none of the things that you would see with addictive substances. Um, yeah, it's just a discontinue. It's certainly not addictive.
Good.
Mm.
So Khalid, one of the questions here, I'll just put this on the comment here. So, Brother Tui asked about, is curious whether there is a reluctance in the Muslim community to get help for mental illness. What's your thoughts, or what's your experience on this?
I can't talk about the community as a whole. I can just talk about people I know and sort of friends and family relatives and like relatives. I don't think it's so much a reluctance to get help, but it's more not recognizing that it's an illness.
Mm,
Um, it's so they would consider it as uh, like something from jinn or waswasa. That's why I'm going
yeah.
through this, because I've been affected. And unfortunately, particularly in the Middle East, and I suspect other Muslim countries, they'd go to unscrupulous sort of, what do I say, sort of, it's almost similar to Christian exorcism, when they go and they read kind of different verses in the Quran in particular orders, nothing which has any basis in religion. But because the person wears the religious garb and they call themselves a sheikh, people go to them thinking that they would cure them by taking that jinn or spirit or whatever it is out
Mm,
of their body. So that's a part that needs significant education, not just from doctors, but also from legitimate scholars. That's one aspect. Others don't see it as an illness as such, but just see it as one of the trials of life, or just have to put up with it. But then I have to explain, well, it's an illness like any other illness. If you had diabetes, you're not going to say, oh, well, it's my lot
mm,
in life to have diabetes. I'll just kind of live with it until I die. You actually seek help.
mm,
And that's a similar thing. So that's what I've noticed amongst people I know within the kind of Muslim community, that they don't see it as a legitimate illness like physical illnesses, but they kind of have other interpretations of it. And from a religious perspective, and not just again Muslim, but I think all the monotheistic religions, um, many times it could be part of this waswasa or one of these trials. But it's, in my view, it's impossible to know which is which. And so I say, look, we'd have to then address it from both aspects. So on the one hand, you read the legitimate verses of the Quran, the ones that the Prophet ﷺ
Listen.
talked about,
Awesome. Yeah.
and do the things you need to do from a religious perspective, but at the same time, and pray, and supplicate that you would be rid of these experiences you're going through. But at the same time, you do what you need to do.
That's right.
Which is to seek medical advice, lifestyle changes, all these other things. So you need to take both aspects. because how would you know which is which? How would you know whether what you're going through is some form of kind of interference from the jinn, or is it a legitimate genetically based illness? It's near impossible because it looks the same. So you address it, in my view, from both aspects. And I've used that same concept with practicing Christians, and they kind of recognize that and accept it and actually feel comfortable with it. So the concept is very similar.
Yep.
I think that's the main thing to consider when looking at it from a Muslim perspective.
Mm. Muhammad Thompson, do you have anything to add on that? I mean, we are doing programs on the jinn and the sihr, Khalid, at the
Yes,
moment.
yes.
So inshallah, we'll have a discussion with the Sheikh on Thursday, inshallah, and we will expand on this as well. And I think this is a very very crucial thing that you do need to seek the help with the doctors, if you need to, a psychiatrist or psychologist. And then obviously you also need, as a Muslim, as someone who have belief, we also do our parts on that side. So they come hand in hand. And that's certain. I'm sure that's the right way of doing it. Mama Thompson, you just want to say something?
Inshallah, I'm going to go over some of the stuff that's already been said. So, because it's just, I'm going to give a little bit from my point of view. You're giving the medical point. I'll give from a layperson, one who's sort of, especially through the COVID thing, has been a little bit interesting and challenging times. So, we talked about some of those 12 points, the routine. I always kept a routine, especially during the COVID sort of thing. Get up the same time, breakfast the same time, do the same sort of things, except, can't go to the mosque like I normally do and stuff like that. But, just try and keep that routine going. Getting outside, getting some fresh air, and sometimes you might just see some people at a distance. At least you can acknowledge some people rather than you're sitting in your own cocoon and not seeing people. At least you might see some people, you might wave out, just say hello from the distance. Getting that exercise as well, that just helps clearing the mind. Because even before the COVID, I used to always try and start the day or end the day, with exercise just to clear the mind and think over things for happening during the day. It's a good time for Muslims also to making zikr and stuff like that to actually help clear things as well, so that it just makes that clear a little bit easy rather than just sitting with things in your ears and listening to some sort of music or whatever. But if you listen to a good lecture or listen to Quran, that can also be good. But for me, I prefer just doing the zikr and stuff like that. And then trying not to worry. My situation, I wasn't worried about COVID so much itself. It was more so because I have a small business, so I was sort of more a little bit concerned about that in terms of the employees, because you just don't know. Because like for me, alhamdulillah, I'm at a stage where I could nearly retire anyway. So it's not that economically a big deal for me, but it's more for other things, supporting other projects and things like that, but also employees. And then one of the other thing is just as a side thing is like the mind is so powerful that we can raise ourselves up or drop ourselves down just by our mind. And there again, we talked about the waswasa. Those sort of things could be playing on our mind and could be bring us right down. But we could also be more positive and try and bring ourselves up. So, is the glass half full or half empty? We've got to try and look always at the positive side and seek others' help for getting out of these things. Because if we don't seek the help, then we could just slide further down. The other problem I used to have on the first lockdown was nearly religiously after Salat, 1 o'clock, 1 p.m. media conference. I planned my day around the media conference, and that was a big mistake. You just sort of so wanted to know what was going on, but this time round I watched one or two and I forget it because it's just depressing in itself. Because when you see the rest of the country is just about in freedom, and Auckland again, we're sort of seen as pariah. We're the ones with the disease, and we're locked in, and no one wants us to come out and visit them or anything like this. So those sort of things we've got to get over that and just work to try and do what we can as Muslims. We have to do what we can to try and overcome these things and follow the rules. As long as within the Islamic teachings, we talked about this before on the vaccination and the COVID thing. We had a program on that before, as saying from Islamic point of view, and what to do and how to follow and things like that. And I think for those who may have a tendency for suffering from depression and anxiety in that, they might, because Dr. Khalid was talking about the medication takes some time to work. And this is where the problem is, that some people might jump straight to drugs. And these aren't medicated drugs. These are just drugs because they get the instant fix of something. They think they're high and everything's running well for them. But I would think, I'm not in that situation, but you'd sort of think, if you're in that stage and then when you come off it, the coming off it would be a lot more dramatic and disastrous for that particular person. And yeah, apart from that, the discussion's been really good. I just want to add those few things in as from my own point of view, inshallah.
Inshallah, that's very good. I think that you mentioned about plan yourself around the 1:00 press conference. I mean, that's exactly what what the news are like. It's about sensationalism, right?
Exactly.
And the more you read, and then the worst thing is, if you at least Muhammad Thompson, on the Facebook, or on Instagram, or on those things, that's even more worse actually. So you got the press conference and you got the social media that just constantly feeding you into that. And then the problem with the algorithm on the social media, you start reading on one thing, and the next thing will be about the same topic, even worse, and it going worse and worse, because that's what the algorithm works. The algorithm wants you to stay and keep watching or keep reading the same thing, because this is how they make money. So, and then you get trapped into that. You're just going in more spiral and spiral down. So this is something actually very important. Clickbait is another thing. It's another term, and so I suggest to those who's watching out there, if you have a Facebook or Instagram, sure, but try to really, really either separate it or only use it. Let's say just make it, you use it only on the laptop or something like that, and don't have it on your phone. If you find if you're in that trap that the phone just keep buzzing, keep making that noise, and give you a notification that oh look, 16 COVID cases today, 15 today. Oh, if we don't vaccinate, few thousand people will die. So it just you need to stop that from keep coming into you. So
well, I've turned off all my notifications. So none of my. So even when you text me, might not get it for maybe a day later, or even these. I turned all the notifications off because it's got so sick of it going beep beep beep, and I feel obligated. I've got to look at it and I've got to reply instantly. It's not what it has to be.
You have to learn to disconnect. Khalid, what are your thoughts about one thing that Muhammad Thompson mentioned about drugs? That's another thing that when you are so much stressed, and that's when you look for to use drugs and things like that. What are your thoughts on that, and any comment on that?
Yeah, well, sadly, just from my own experience with the people I come across, the use of drugs isn't really related much to stresses and COVID, but it's more because it's enjoyable and
recreational.
Yeah. And so regardless of COVID, I mean, I think I haven't seen anyone take up drug use because of COVID. It's always been there before.
No, I was more referring to not for COVID so much, but more anxiety and depression.
Yeah,
as an overall thing. Yeah, not necessarily just COVID.
Oh, definitely, and in these cases, unfortunately, and I think that's where Firdaus would recognize, they would go and look for sort of more fast-acting medications from their GPs, and unfortunately, because they are easy to prescribe, have relatively limited side effects, but are highly addictive. Patients get prescribed this. So what we do see many times is we actually have to contact the different GPs, particularly if it comes to our attention being more central that the person is being GP shopping, and even sometimes even go to the ministry to put notifications that that person is drug seeking. So these are the kinds that I've seen when people actually do seek addictive medications, although they are prescribed to alleviate the anxiety. unfortunately, they do alleviate it. I mean, and they work really well. So you're feeling anxious 1 minute, you take the tablets, within an hour, you're feeling great, but it only lasts a few hours.
Mm.
And you're back to where you started. And it's not just that, but also because then you get used to the tablet, then you lose your own coping mechanisms.
Yep.
So whatever way maybe you and I or most people would use, when we're anxious or distressed or feeling under the weather, of how we would internally work on ourselves to cope with the situation, the person who's used to taking a tablet and then feeling better, they don't expand that ability and end up losing it. So yes, you're right.
We're talking about benzodiazepines, right? Yeah, which is
Yeah.
yeah.
So that's one aspect. Depending on sort of your social circles, particularly in New Zealand, some people would go to using, particularly with pain, they would go to the tinny house to get marijuana, because it does help with the pain, and it does kind of make you put up with a lot of things. And so people kind of find this as kind of a placating aspect, but then it brings you in touch with other drugs, and it's an endless cycle. I mean, once you're stuck into it, it's really difficult to get out of. Yeah.
I mean, we won't talk about too much detail about cannabis use and all that. We do know that that younger you are, if you are while the brain is still developing, and then if you use it, and you tend to get problem with anxiety and depression, for example. And we do know that. So alhamdulillah, I think we had a good discussion. Alhamdulillah, this is a very good introduction. I think we need to bring you more often, Khalid, just to talk a few things. Maybe the next thing we'll talk about, what's the other thing, ADHD or something along that line that we can talk about.
You give me too much credit for those.
It will be good, because the first step, I think what we're trying to do here, we try to normalizing it. We try to normalizing the issues, the condition here, mental health. So then, only then you can seek help, because the first thing, like, you have to accept it, that there is actually an issue, there's a problem, then you can actually go and solve it. And yeah, alhamdulillah, and I think this is really good discussions. So we covered in the anxiety and depression. We covered COVID-19 and how it can give you it causes a lot of anxiety on people at the moment. And we've also had a good discussion around what Thompson share his ideas about watching the 1 p.m. briefing. So now I think whoever watches this video, maybe you shouldn't be watching the waiting for that. You just wait for the news to come out and just read one paragraph about it. How many cases today? and again, try to disconnect. I think that's, from my perspective, the biggest thing that I remind my patient is to get disconnected sometimes. Stop your Instagram, stop your Facebook. If it's not stopped completely because it's a means to you connect with others,
except for Voice of Islam shop programs, you mean? They're on Facebook and Instagram, so Twitter.
Fair enough. I just wanted to share one more thing, though. One of the things that to those who are needing psychologists or counseling, but rather to do it on their own, the self-paced, you can go to Mentemia, which I mentioned before. Or you can also go through one of the courses that I like is the Just a Thought, and they have a very good courses there. The anxiety and then the mixed anxiety and depression, and I think they're a good start if you just wanted to go a little bit and try to do it on yourself. But again, the first person that you should go to if you do need help is your GP, a doctor, and nowadays almost every GP practice will have wellness advisor, and they are free service for you to use. So you go there, and then if you work for a big company, majority of the company will have their own support. I think I mentioned before one of the company called Race. I know there are a few others companies out there. You can go and get the support from them. Normally, you will get free counseling to certain times. And if they think they need more, sometimes the company may approve you to have more counseling. Sometimes that's actually a lot more faster than going through your doctors. But you can always go to your doctors, go to your wellness advisor, and then go through your company if there is such support. And hopefully, you don't want to see Khalid, because if you see Khalid, it's that means you are
Things are dire.
that things are a little bit more stuck with you. So Alhamdulillah, I think that's a good discussion.
So can I
And
just ask something
I
here then?
I'm
Can I
done here,
just
so
ask?
you go on. Yes.
No, because we're talking about going to your GP first.
Yep.
Now, especially in Auckland, now we're still under level 3. How
Hmm.
does that going to work then? Is it just going to be on a Zoom discussion with your GP, or because some of those things I would think you'd need to be face to face, not just
Yep.
over some screen, and they could easily just turn off. But if they've actually come in and things like that, it could be a lot more beneficial. So, like, how does it work then under, say, level 4, level 3? I know the
Hmm.
rest of the country are under level 2 or whatever it is, so it's not really that of an issue there, but mainly in Auckland.
Yeah. So I think different practice will have a different way of doing it. At least you can have an appointment over the phone. But in certain cases, if the GP deem like, look, maybe we shouldn't wait until the lockdown ended. Maybe you should come in person and have a chat person face to face. You can still do that. Definitely in my practice, if I talk to someone and I say, look, maybe it's better for you to actually come in. We just have to do what we have to do. We just have to wear our gown, we have to wear mask and
Yeah.
everything, and the 2 meters distance, and talk to the patient as per the guideline from the Ministry of Health. It's still there. The service is still there. It's definitely
Yeah.
there. And but you can always ring first and have a chat with your GP and find out first and go from there.
So you don't suggest Dr. Google, though, do you? To be your
Well,
first point of call.
if you go through Dr. Google, you will find a lot of things, and you get
Yeah, I
more
know.
anxious, you get more
Yeah, I know.
depressed,
That's the
and then
thing. So it's,
and that's one of the things that people come in anxious because they read about something and they're like, oh my God, I've got cancer, I've
I've got
got this,
this and I'm
I've
going to
got that,
die in
I've got
5
that.
minutes. Yeah.
That's right.
Yeah.
But hey, look, this is why we go through schools 6 years. It's not as easy as just googling it. So yeah, so good point, Mama Thompson. Good point. Good point. And even in lockdown and in general practice, you can still speak to your doctors, and your doctors will decide whether you can come in or not. And then I know in my practice, in our practice, we do see patients if we have to, and
Yeah.
obviously with all the precautions and
Yeah.
and then your GP tend to know you quite well. So if they're a bit worried about you, obviously they will arrange something for you.
Yeah.
Yeah. So that's
Cool.
yeah. So good discussion. I think a very, very good discussion. I really enjoy it. Mama Thompson, thank you for sharing. And I think
Welcome.
we should close now. We'll get to you first, Mama Thompson, and then we'll go to Khalid just to the last words before we end, inshallah.
All right. Oh, Jazakallah everyone for attending, and our guest, Dr. Khalid, and also Dr. Firdaus. And just to look after yourself. If you're living in a bubble with people in there, especially in Auckland, those places, stay close to them. Talk to everyone. If you're outside, just ring someone. Ring those numbers, important numbers, because there's always helpline and things like this that can help. And just look after yourself. Look after yourself, inshallah. Jazakallah. Assalamu alaikum.
Alaikum salam.
Khalid, just a few closing words, inshallah.
Well, not much more to say for this except to thank you and Brother Muhammad for this opportunity, and to hope that what I've said can help some people and make some sense. It is a difficult topic to tackle because the boundaries are very blurred in it, and I hope this has been useful somehow.
That's definitely useful. Jazakallah khairan, and thank you for watching. We'll end the program, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.